The annual election period is coming up for Medicare, and SMG Health is doing Medicare workshops throughout the fall at local libraries at no cost to you. The owner of SMG Health is Joe Garcia. He's here to tell us what we need to know. Joe, this is your specialty.
Yes, it is. Thank you for actually having us on the show today.
Sure.
Yeah, a lot of seniors get anxious a little bit when it comes to this time of year, October 15th through December 7th. And there's a lot of decisions to be made. And one thing that we're here is to kind of help them out. Number one, it's very interesting for them to take their information and that they're going to receive in the mail. It's called an annual notice of change. And they should review this information. A lot of times seniors throw their mail away, looks like junk mail. But this is something they should not throw away at all. It's a good place for them to start to look and see what changes are going to be made to their existing plan. And then from there, they can decide from October 15th to December 7th, have that research time to look into another plan.
I'm going to ask some really basic questions. As people, approach this, they don't know. So when you hear, okay, I'm old enough to be on Medicare, is there a charge for that? I mean, is that something that you've paid into and is covered?
Yes, so most folks that are turning 65 will receive Part A for free.
Okay.
That's no cost to them because they've been working at least 10 quarters of their life. And then Part B, there is a premium for that. Part B is $134 this year, and it tends to go up a little bit.
$134 per month?
Per month.
Okay.
Yes.
And then that's where there are different choices.
Yes.
Pertaining to, tell us about some of the differences.
Yep. So right now, the annual election period, October 15th to December 7th, what we're talking about is folks that are either on the Medicare Advantage plan or prescription drug plan.
Okay.
Those that are on the original Medicare, the choices that they will have to make are, do I need to change my prescription drug plan?
Okay.
Or do I want to opt out of original Medicare and go into a Medicare Advantage plan?
Okay.
And then from there, there's some changes that can be done afterwards, and that comes January 1st to February 14th. They can opt out of Medicare Advantage plans if they don't like it and go back to the original Medicare.
Okay. So as you said, there's a lot of considerations that people need to know and a lot of questions that they have. Now, your company does sell these plans, the Advantage plans and the B.
Yes. We're an independent broker. We represent many companies on the Advantage side and the prescription drug side, as well as the Medicare supplement, traditional Medicare supplement side. We don't sell Medicare Part B. That's something that the government gives you.
I see.
And I just also would like to let seniors know that if they need more help, they can go to Medicare.gov. Has a lot of good information there for them to weigh out on their own. And then if they're confused, they probably should go see an independent broker.
Okay, and that would be someone such as yourself.
Yes.
But you are going to be doing these workshops where you're going to be explaining this in much more detail so people can get ready for this open enrollment period. So you have them all over the community.
Yes. We have several workshops from Otsego to Plainwell to Three Rivers, multiple workshops at these sites. And as well as we have a pop-up fair at 1300 West Center Street. That's going to be October 16th. And this is a good time for folks to, if they do have questions about their annual notice of change, that they should receive by September 30th. Medicare Advantage companies and the prescription drug companies are required to get that information out per CMS, Centers of Medicare and Medicaid Services, by September 30th. And if they don't understand those changes, it could be changes in their copays, their deductibles, the treatment of coverage, then they can stop by on October 16th and we will have someone there that can go over that with them.
Okay. Is there anything for seniors to be concerned about as we listen to the news right now? I mean, healthcare is on the news over and over and over, and what might happen to the Affordable Care and all of this. Does any of that affect Medicare?
It does and it doesn't. A lot of the Medicare that's being affected is either premiums increasing for Part B, co-pays going up, or funding for places like MEP. Senior Services offers a MEP program where seniors can go in and get information and help. And some of that funding is on the border and may be cut.
Okay, so pay attention to the news,
yes.
Call your legislators, all of that. Yes. But in the meantime, the period is coming right up for people to make their decisions.
To make their decisions.
And that's why attending one of your workshops would be very beneficial to them.
Yes, it would be.
Now, and I know, Joe, too, you said that you will be hanging around after you do your presentation if people have questions specific to their own situation.
Yes, I'm always there afterward, and it's question and answer. There's no policies or anything that's being sold. It's just informational. And the folks would have to, either call our office to talk with one of our representatives.
Okay. No registration needed for these workshops that we're talking about, though.
No.
Just show up.
To show up. We have people that are doing blood pressure checks. We have podiatrists and all sorts of neat things that are going on pertaining to senior health.
A lot of information available at these free workshops.
Yes.
So we want to make sure everyone takes advantage of them. If you did not catch everything as we were showing it, we're going to have that up online at wwmt.com. Just find our segment. You can get all the information there. Or if people need more information, they can contact your office. And how do they do that?
Yes, they can contact our office. Telephone number is 903-2510. They can also go to our website, smghealthus.com. I did publish a Medicare blueprint for seniors that are aging in to Medicare, 64 and a half, as well as there's information in that blueprint for folks that are over the age of 65 that have been on Medicare forever, and sometimes they get complacent and just keep paying the premiums that the insurance companies are charging, where they could pay a lot less.
Okay, it's good to be proactive in this.
Yes.
If people want this pamphlet, how do they get that?
Go to our website, smghealthus.com, and they just sign up for it. They'll see it right there, and it downloads, or they can call our office and we'll send them one.
Thank you so much for being here with this important
Thank
information.
you.